Hello and welcome everyone. Myself Dr. Alim. I am a homeopathic practitioner. I have been into practice for more than 30 years now. I am practicing in Dubai and Mumbai. I also see patients in many different countries through my online consultation service. In my long career, I have come across patients suffering from many different types of chronic health problems. I usually see more of chronic problems because patients who approach me for homeopathic treatment have usually tried many things. They have tried conventional treatment, either they are better but not completely with the treatment that they are already taking, or they are experiencing some side effects by continuing those medicines and they do not want to suffer those side effects, and that is why they want to try something which can help them get better, at the same time keep them free from side effects. Whenever I am approached by any patient who is already suffering from a chronic problem for a long time now and who is already on conventional mode of treatment or some other treatment and seeking my help for further improvement in their health condition, I usually study the whole case very scientifically. I go through their reports, I go through their previous prescriptions and understand what all has been done for them and what is the way forward now. I consider this point very seriously because somebody who comes to me who is suffering from chronic health problem and he is already on some medication, before homeopathic medicines actually start helping, stopping those medicines will make the patient experience turbulence. He may experience symptoms suddenly worsening, and many of my patients who share their experiences with other homeopathic doctors who follow this practice, they tell me that their homeopathic doctor told them that in homeopathy disease usually becomes worse in the initial phase and then it starts getting better. No, homeopathy is a very gentle science, and the first principle of homeopathy is to bring the relief in a very gentle and in a very easier way where the suffering doesn't become worse. Actually, that suffering which patient experiences immediately after starting medicine may be probably because they have suddenly withdrawn the medications that they were already taking, not because they have started homeopathy and homeopathy is making it worse. So I very scientifically evaluate what is the current situation, what is the role their existing treatment is playing, and accordingly then take a decision. Of late, what I am noticing is that there is a sudden increase in patients suffering from thyroid related problems. Thyroid is a gland located in the front part of your neck, and it can cause three different types of problems. Either the person can suffer from hypothyroidism, where their thyroid gland is not functioning enough, or they suffer from hyperthyroidism, where their thyroid gland has become hyperactive, or they suffer from swelling over their thyroid gland, which is known as goiter. In all these situations, approach of conventional medicine is that they put you on lifelong medications. They can be either thyroid hormone supplement, which is the case with hypothyroidism, or they can be medicines to control hyperactivity of thyroid gland, which is done in hyperthyroidism. When somebody has the swelling of the thyroid gland or goiter, what we call it as, doctors usually monitor the growth for a while by repeated scan being done once in 6 months or once in a year, as the case may be. When they see that this gland is increasing in size, they usually recommend that patients should undergo surgery for removal of their thyroid gland, either partially or completely, because this kind of swelling, which is gradually increasing, runs a risk of developing cancer. At least as per the statistics, 40% of patients have a risk of developing cancer. So they recommended to remove it. Surprisingly, in the initial stage, patients do not realize that they are suffering from thyroid related problems, because the symptoms in the initial stage are something which are not seen as an illness. For example, somebody might start feeling lazy, somebody might start suffering from low mood, somebody might start gaining weight. In females, there will be period irregularities, mood fluctuations, which normally we attribute to change in lifestyle or some stress related problems in our routine. As per the statistics, in United States alone, there are nearly 20 million people suffering from thyroid related problems. And what is more surprising is that 60% of them do not even know that they are suffering from thyroid problems. Because as I discussed earlier, in the initial phase, people don't pay attention to the problems very seriously. They don't look at it as some kind of illness. But when their symptoms get worse, they actually approach for help, and doctor will immediately suggest to do the test. Recently, I had an experience where patient was saying that she is suffering from thyroid for last 20 years, and for the first 10 years she was not even detected to have thyroid, because in earlier days thyroid was not so common and doctors did not recommend doing thyroid related test as a regular screening. But in today's scenario, the moment somebody says that there is a weight gain issue, the moment somebody says that there are fluctuations in mood, or when female complains of irregular periods, first thing doctor does is doing the test. And that is the reason why we are able to detect more and more cases in current time. Even children as a protocol undergo thyroid test when they see that there is an issue of children gaining weight suddenly. Okay. Now you will wonder, as a homeopath, why am I talking about conventional mode of treatment, or why am I talking about what is the current situation with thyroid problems? There is a reason to it. Me as a homeopath come across many such situations where people approach me for their thyroid related problems, and why they approach me is also very interesting, which I must share with you all. In fact, that is the reason why I got this thought that I should make a video and present it with all of you out there. Somebody might be helped with this experience sharing that I am going to do. Patients who are already on thyroid medications for 5 years, 10 years, they are already taking thyroid medications. But despite of that, they continue to experience some or the other symptoms in greater or lesser degree. And when I ask them, since you are already taking medicines, why are you still experiencing symptoms? So they are not having any answer for that. And when they discuss the same with their doctor who is managing their thyroid problem, they also don't have an answer to that. Many times the experience that patients share with me, that once in 3 months or once in 6 months they will do their thyroid hormone test, they will meet the doctor, and doctor will just adjust the dose, and that's it. There is nothing beyond this. And believe me, they have been doing this for 5 years, 10 years. And what is the future? There is no end to it, because doctors tell them that they will need to continue for the rest of their life. On the other hand, what homeopathy does, It heals your thyroid problems naturally with safe and effective homeopathic medicines. The difference between conventional mode of treatment and homeopathy is very clearly seen and experienced by my patients. Suppose somebody who is taking thyroid medicine for 5 years, 10 years, 15 years suddenly stops thyroid medicine. The moment they stop, their thyroid hormone levels start fluctuating. They again start experiencing symptoms, or their existing symptoms start getting worse. Now, what does it mean? At least to me, it means that whatever medicine they were giving were targeted only towards keeping the thyroid hormone level within normal range and controlling the symptoms. They are not acting as a remedies that would someday heal their thyroid and patient would someday get free from thyroid medications. As a homeopath, I have experienced and I have seen that happening in my practice, that once the person starts with homeopathic medicines and once they start seeing the improvement in their symptoms, we start reducing their thyroid medicines. And despite of reduction in thyroid medicines, their blood report levels remain stable, their symptoms are better and not worse. What does it mean? That homeopathic medicines are healing the thyroid gland from within, and they are not merely acting as a symptom controlling medicines or supplements, because homeopathic medicines do not have a property of supplying you thyroid hormone or suppressing your thyroid gland activity. Homeopathic medicines have a completely different mode of action in your body, wherein it stimulates healing from within. Of course, apart from medicines, one needs to practice a good lifestyle. Regular pranayam, yoga, physical activity, healthy diet are all essential part of treatment and not just a lifestyle. These things along with homeopathy will make you feel lot better, and provided you have taken the homeopathic medicines for the required period of time, you will one day see that you are becoming free from thyroid medicines, or at least your need for those medicine is reducing in dosage, which is a very good change according to me, a change towards healthy life. I have found some medicines very useful in managing thyroid patients. Thyroidinum 6C, Natrium 6X, Iodinum 6X are medicines which I have used very frequently with very good results. But homeopathy is not a disease specific science, it is a person specific science. Now you will ask me, what does it mean? I will make it simple for you. If 2 or 3 or 4 patients who are suffering from hypothyroidism and they approach conventional medicine doctor, they all are recommended the same medication. Depending upon the severity of their illness, they may be given different dosage and repetition of the thyroid medicine, but medicine is mostly same. That is called as a disease specific science, that a particular disease gets the same remedy irrespective of who is the patient. But in homeopathy it is not so. Homeopathy is a person specific science. Homeopathy focuses a lot on patient's nature, temperament, lifestyle, manner in which they are dealing with the stress in their life. All these informations gives us an understanding of what is the type of constitution you are having, and based on that, what is the best medicine for you I will decide. This is how homeopathic treatment works, and that is the reason whenever you are approaching a homeopathic doctor, one who is practicing scientific homeopathy will always show interest and desire to first study your case in totality, right from your childhood till now, what all things you have gone through. Not necessarily that everybody has suffered from many different type of illnesses from the childhood, but there are many events in life that person has gone through, and manner in which you have dealt with those events gives us an understanding of what is your sensitivity, what is your constitution. Of course, all these chronic illnesses are believed to be having a genetic cause as an origin, but for example, in a family, if there are 3 or 4 or 5 siblings who all share the same genetics, do not suffer from same type of illnesses. Everybody has a different time of suffering and different illnesses. Now this individual response or this individual health status is because of their own sensitivity. Many a times, or almost 90% of the times, whenever we are doing this kind of study, I have come across the fact that the onset of illness matches exactly the time of stressful period in patient's life. Although other siblings were also going through the same stress as a family, but they did not suffer, but this person suffered. This speaks of this person's sensitivity, and me as a homeopath focus on this sensitivity of the patient and then decide which is the best remedy for him. I have given few tips on the medications that I have commonly used, but I would say that these medicines should be used under guidance. If you come across anybody who is suffering from thyroid related problems and not getting better, or is partially better and his symptoms are fluctuating, do recommend them to think of starting with homeopathic medicines or adding homeopathic medicines to their existing treatment. Do consult an experienced homeopathic doctor who can really guide you well for further course of treatment. Do like and share my video as much you can. You never know whom you will help. Do subscribe to my channel and stay tuned. I will keep sharing regularly lot of health related tips and valuable experiences that I have gained through years of homeopathic practice. Thank you so much. Have a happy and healthy life. See you soon. Thank you so much.